The Human Organ Transplant Bill will provide the legal regulation and practice of human organ transplants in Guyana. Dr Kishore Persaud is the head of the Transplant and Vascular Department and a transplant surgeon at the Georgetown Public Hospital. He was the one who drafted the legislation and for years has been lobbying for the legal framework to govern the highly technical and medical exchanges of human parts.
Since 2014, upon my return, this is one of the dreams I wanted for us in transplantation in Guyana. While we wanted our program to be a success, and the success of our program is what pushed this legislation moving forward. Because if transplantation was never successful in this country, there will never be a need for such a legislation.
But what does this really mean for ordinary citizens and patients? There are hundreds of patients who are awaiting kidney transplants. There are some with compatible donors, while others who have donors that are not compatible with them. This legislation will now provide for organ sharing in situations like these, whether locally or with Caribbean countries. Meanwhile, for the number of patients on dialysis treatment, the legislation allows for them to be put on a cadaveric donor list, meaning that if there is a brain-dead patient who is an organ donor, doctors can now legally utilize that organ. There are over 150 patients awaiting kidney transplants, with over 25 patients on the living donor list. Importantly, the legislation further creates room for the development of medicine in Guyana.
What the legislation also caters for is for us to determine patient compatibility and suitability for kidney transplant. That by itself will create the room for us to implement the laboratory facilities to do cross-matching in Guyana.
Meanwhile, Health Minister Dr. Frank Anthony said he was satisfied that the government had done everything it needed to and sought both international and local professional input before bringing what he described as the most advanced piece of legislation in the English-speaking Caribbean.
This is just one of many bills in the health sector that will be coming because we want to modernize the health sector. We want to make sure that we have all the legal provisions to ensure that we can deliver quality health care in this country.
Opposition Member of Parliament Dr. Karen Cummins said transplantation will reduce morbidity and mortality.
In Guyana, transplantation today is constrained not by medical issues, but by legal ones. And their resolution is essential to saving lives and reducing human suffering.
The legislation also protects citizens from illegal transplantation and trafficking in human organs, thereby creating offenses and penalties to guard against such grim acts. A national human organ and tissue transplant agency would also be established to manage the removal, donation, and transfer of human organs. People who are willing to donate their organs for transplant to help improve the lives of other individuals or for use in scientific research will be part of a national donor and transplant registry. Reporting for the newsroom, I am Isanella Patwo.